wanted to talk a little bit about technology at Smith Facial Plastics and some of the choices we've made along the way. We've collected a whole host of technology over the 15 years that I've been in practice, and my first device was CO2. We still use that in the surgery center setting. It's either fully ablative or fractionated, and then we added V-beam pulse dye laser, and then subsequently BBL and PicoSure and other things. And a lot of times we get asked why we haven't added Ultherapy to the practice. And what I do when selecting a technology is, I have great resources in terms of being involved with our national academy, the American Academy of Facial Plastic Reconstructive Surgery. And I've got a lot of people that I really trust in the industry to give me good counsel when buying expensive technologies. Certainly, if we're going to have something that is uncomfortable for a patient or is costly, we want to make sure that it delivers good results. And so that's the way that I've vetted every technology addressing skin in our practice over my 15 years. Ultherapy is one that I haven't added for those reasons. It's something that I've had the opportunity to talk to colleagues that have brought it into their practice and tried to get a feel for patient experience, patient satisfaction, and it didn't quite hit the mark for me in terms of taking on that risk. Ohio has always been a little bit more of a conservative state, and so there isn't a whole lot that we can delegate. I think a lot of our colleagues have added technologies that they can delegate, so they're not hovering over those results the way that we have with the technology that we have brought in. But the challenges, I think, with something like Ultherapy is that it's an externally applied energy device, and anytime you have something that's externally applied, whether it's radiofrequency or ultrasound energy, a lot of that energy is going to dissipate before it gets to the target, and that target is the deep dermis. That's where we want to see our energy delivered so that it can stimulate some contracture, tightening, and subsequently collagen production. As an alternative to that strategy, the beauty of those strategies, again, is they essentially have no downtime, but the alternative in the marketplace these days is something like radiofrequency microneedling. And the device we have here essentially leads to no significant downtime, maybe an evening of being a little bit red, and it allows us to directly deliver energy to that target layer, again, the deeper dermal layers where collagen is made and contracture is able to be achieved. And so that's why in a practice that is full of technology and most of which I consider to be best in class has not added certain therapies, including Ultherapy, in our practice. And again, the summary statement is because I think we have much better alternatives to accomplish the goals that folks have for a device like Ultherapy, which is some improvement in the texture, tone, brightness of the skin without any significant downtime.